Hello, my name is Ryan,
My name's Jennifer.
and we have the virus hepatitis B. So to start things off, the viral genome type of HBV is presented itself as a partially double-stranded circular DNA molecule and ha has about 3.2 kilo base pairs. In regards to the mode of transmission of HBV, it's spread via direct contact via sex, which is vehicular transmission, or via bodily fluid transmission, whether it's blood, semen, or other body fluids like I don't know, menstrual secretions, where it infects the a person. Well, excuse me, it infects a person who is infected infects another person who does not have the infection. And it can also be transmitted via sharing needles via the parenteral route, such as like getting a tattoo or drug use. Okay. In regards to the signs and symptoms of HBV, some of the acute symptoms that you would necessarily possess, things like abdominal pain, dark urine, fever, joint pain, loss of appetite, nausea and vomiting, weakness and fatigue, and then you can also turn pretty yellow due to jaundice. Some of the chronic some of the chronic hepatitis B infection symptoms, it could necessarily lead to like liver failure or cirrhosis. Okay, next slide, please. In regards to how the virus does damage, the main focal point for HBV is that it damages the liver. The virus itself can cause inflammation to the tissue, where long-term inflammation of the liver can necessarily lead to cirrhosis, which is just a lot of scar tissue. Um, it could also another I guess feature that the chronic hepatitis B infection can necessarily do is like it cause liver failure, cause cancer, and it can also actually reactivate the hepatitis B virus itself. Okay.
Okay. So the mortality rate of hepatitis B. So worldwide, there's about 820 deaths per year that are attributed to Hep B. And within the United States, there's 125,000 deaths per year that have a link to the viral Hep B. And this number, I think within the United States is it's pretty high. There's obviously some numbers that may not be reported as well, just because um there's also like a certain since HPV falls under like a sexually like transmitted disease as well, there's some like stigma behind people getting tested. Um, and that's why I feel like these numbers are pretty low. So in terms of distribution as to where this pathogen is found, within the world, this Hep B can be found anywhere, but it has higher numbers in Africa and Asia. And in this map that we're able to see on the screen as well, the darker blue colors indicate a higher concentration of Hep B infections. And we see Africa over here and Asia over here with the higher numbers. The US um, has it's more on the lower spectrum over here, but since we have less people here, that's why there's a lower concentration. And who can spread the virus? Drug users, people who are using needles, tattooers are at a higher rate to get Hep B or be exposed to Hep B, along with sexual contact and fluids such as semen, and vaginal secretion can also lead to the spread of Hep B. And as we stated before, Hep B can be found in the liver, as that's where it attacks. So treatment and preventions for hepatitis B are vaccinations and antiviral medications. So hepatitis B is preventable with a vaccine, and it's a vaccine that babies within the US receive as soon as possible after birth, and this follows within a 24-hour period. And then this is then followed by 2 or 3 more doses of Hep B for at least 4 weeks that are 4 weeks apart after. So chronic hepatitis B can be treated with oral medicines such as tenofovir or entecavir, and both of these are all oral medications that you can take. And I have them listed on the screen over here. And then most people who start Hep B treatments have to continue it for life. And then this is our bibliography.
Thank you.